I forget what my, okay, everybody, we're gonna get started with a little exercise. Thank you all for being here. I see it's a smaller group. I know that boundaries and ethics are not the sexiest topic. I appreciate you guys caring. We hope to introduce some new ideas and concepts to you, but we also want to offer the opportunity to share your ideas and your agency's policies. So to get us started with our boundaries and ethics conversation, I want you all to break into groups as a table, and you're going to talk a little bit more about what your agency's policies are around boundaries and ethics. Anything that stands out to you, we're just having a conversation at our tables about what your agency's policies are around boundaries and ethics. We're going to do about 5 minutes. All right. Enjoy. Same for you, Zombies. You guys are going to talk as this group of 7 about the boundaries and ethics policies at your agency.
Hi, this is Shauna again. Maybe I'll be the conversation starter. It looks like it's a small group.
For our folks joining us, we're just having a table conversation about boundaries and ethics policies at your agency. What's your agency's boundary or ethics policy?
Yeah, so here I'll turn my screen on. This is Shauna on Zoom. I'm with Bridge Meadows. I'm a community program manager for 3 sites in Redmond, Beaverton, and North Portland. And one thing that I thought of to just kind of kick off this conversation is we have a practice in place where time with anyone in the community needs to be observable and interruptible. So whether it's a community support specialist meeting with an elder, a youth, or a family member, a parent, or even a group, that there's a line of sight. I, as a supervisor, know that those meetings are happening, that sort of thing. So observable and interruptible. What other things do we have in place at your sites?
Thanks for sharing, Shauna. I am in the business of learning about permanent supportive housing. So currently I work at a low barrier navigation center in Bend, Oregon, and I've been doing that work for the last 15 months or so. And a little bit of a different environment than the things we're talking about at this conference. But we are working with a couple of partners in developing a permanent supportive housing facility that will be new and will be opening the fall of next year. So we're in the planning phases and basically learning right now. So all that to say, I don't have much to speak on. I could talk about things that we do within the lighthouse to try to have good boundaries. But it's a pretty different environment than what we're talking about here. So
I want to remind you, there's confidentiality, there's boundaries, there's ethics. And what I hear is some of you are talking about personal, your body boundaries, and some of you are talking about your program boundaries, your organizational boundaries. So I want you to think about it in that context, right? It's like, don't touch me. I heard over here. You know, you can't come. You can't join. Sometimes we have that, right? If you run a children's program, you don't have grown-ups come unless they're volunteering to help, right?
Yeah, Shauna, I'm curious, with the boundaries that you described, it sounds like you have a mixed population of families, older adults, and adults. And so, is that, and so you have these written policies for how those groups, I guess, interact, or you know, the boundaries around those interactions. Is that, I mean, has that become an issue, or were those rules developed because of, you know, things that were popping up, or was it just from the top where you guys were doing that?
That's a great
All
question.
right, folks, we're finishing conversations. You got 1 minute
Tammy.
left. Sorry.
Yeah.
Yeah.
These go so quick.
Right.
Yeah, and just to clarify, yeah, the interruptible observable is really the staff and resident kind of interactions. Bridge Meadows is unique as well in that
All
we
right. Are we
are
designating
encouraging,
a
like,
group
community
speaker?
interactions, and that's a different can of worms.
Hopefully self-designating. I see some finger pointing around here. All right, folks, we're finishing up conversations. We're going to do a share out. So I'm hoping you all have designated someone who's feeling chatty. All right, everybody have a group speaker? Group speaker? Okay, let's start in the back of the room. So we're talking about, yes, I saw the glow on your face. I was like, she's got it. She's got it. All right.
You're just gonna nominate me too.
Yeah. You locked eyes. You felt it.
Okay, so we talked about dual relationships and permanent supportive housing, just making sure that there's clear boundaries and confidentiality, and just being really like innovative of how, if this is this person's family member, we are not going to deny them services. We're going to still serve them. We're just going to reassign them and make sure that everybody is getting equal services and fair, and also confidentiality. We also talked about like maintaining a positive rapport between like property management and any of the service components. That makes sense? Did I miss anything?
That makes a lot of sense.
Are we clear? Gifts. Oh yeah. And there's a gray line between like accepting or giving gifts $5 and below, you know, because we serve with excellency. You know, we want to honor the gratitude. You know, we had a participant who bought all of our staff members the greeting cards, you know, so we accepted it. And we have another participant that likes to cook for us. So instead of us just accepting it, we made it everybody gets to accept it. So just a fair thing.
I love that. Thank you so much for sharing. Thank you. Little animal print. All right, good share. Thank you so much. All right, folks, you guys have some standard practices at your agencies you want to share? The cute glasses. Yes, you can do this.
Let me see. So it is one of our standard practices as a peer support person or as a housing specialist that we are not to enter into the home of the opposite sex. So like a male participant and a female participant, she needs to have someone with her, vice versa. And what that is not to get into the whole wide spectrum of, you know, sexuality or anything like that. It's just safety wise and to hold each other and everyone involved accountable so that there isn't any hearsay, any false reports, any misconduct so that everyone involved is safe. And so we partner up. There we go. Partner up, going to see residents. And I wasn't here for what she said, so.
May I?
Yes.
We also talked about, we all are on the same page. Our organizations don't do wellness checks for our residents. So if we have a potential emergency situation, it does require emergency personnel called 911 or cahoots or the police or whatever. We do not gain access to their home.
Interesting. I'm hearing some new things. Thank you for sharing. Appreciate that. All right. Do we have all right.
Hi, so I've been taking notes. So mostly the theme here is just a lot of boundaries and expectation of roles. So from what I gathered, boundaries between property management and resident services and what those are and how they're implemented, and also the differences between the different spectrum of sometimes there's property managers that are super open and supportive, and then sometimes there's property managers that are just like, do everything. Then we shift to like our corporate companies we work with and what their expectations of our roles are and how sometimes we have to wear so many different hats. Then from what I also heard, learning to be careful when dispensing certain advice, especially legal. You have to make sure you either refer them to a lawyer or consult with one, just to make sure that you're not getting yourself in hot water. And yeah, I think that's it for this table. Anything else? Okay.
Brilliant. Thank you so much. Good share. All right. We got a eager sharer.
So one of the things that our supervisor is always reminding us is the fair housing. What you do for one, do for all. So if you're not willing to do it for all, you cannot offer it to do it for one. So just for out of fairness, and also we had a little more robust talk about how, like, when there are kids on the property and you're somebody who's been consistent and somebody who is safe, and the kids want to hug you, and it's like, how do you roll out of the too long of a hug, or how do you break that without crushing a spirit and keeping the relationship going, but in that positive, healthy role modeling way. So come to me for some tips, because I used to teach elementary school. I got them.
Thank you so much. I love it. All right. Do you folks have someone who wants to? Everyone's pointing at you.
With Schnitzer Properties Incorporated, it's a private equity firm that has a motto for all of its employees: friendly but not friends. And it is more than a motto, it's actually a concept that is used to underpin all of the policies that we have. And in addition to anything that has to do with fair housing, we have to address a large number of our folks who are from other countries, who have a tradition of, when you do them a favor or help them out, they want to reciprocate. It's just human nature. And so what we have come up with is, if they bring a plate of food, which is common, then what we will do is say thank you, and then we will share it amongst all of the staff who weren't connected to that transaction, so that in our minds, it tends to make us feel like we're not being, unethical in the sharing the food amongst all the staff who weren't, again, involved directly with the transaction. That is one of those little gray areas. But we don't want to do is to scuttle the professional relationship that we have with our residents who don't understand our cultural reference in this country, having come through and now are going again through much corruption. So just saying. that was from the But in addition to that, we also were talking about recreational programs and for kids growing up, and reflecting how great those were for ourselves as children growing up, and how that is so important today, despite the fact that so much that doesn't happen in public schools can happen in our little vertical villages that we have. So absolutely, it stays with you. Yeah.
I love that. I love the word. I've never heard vertical villages. That is a beautiful term. Thank y'all for sharing. All right. How about you folks? You have a designated speaker?
Yes, I do. Wow, you picked me out like immediately.
Tractor beam.
That was impressive. Yeah, we covered a few bases. I think initially we set out with a question that we didn't really find a resolution to, which is how are we able to navigate boundaries with residents that are sort of already somewhat disconnected from services and programming, who aren't, coming out of their unit for much of anything. Where do ethics and boundaries come into play with a resident who, for whatever reason, may simply not wish to be involved with resident services? And that question was left kind of open, and we didn't really come to an answer on it. But we have at the table a pretty good mix of resident services and healthcare provision. And one of the conflicts sort of that came up, or a barrier, I guess, is the amount of necessary paperwork, ROIs and HIPAA paperwork around confidentiality when providing healthcare. Not only that it's a challenge for those organizations that do provide healthcare, but that it's a barrier for introducing healthcare provision to resident services. I brought up that I work out of some historic buildings, and they're just not structurally set up for the kind of privacy that would be required to bring in a clinician.
Good share. Thank you. Yeah.
So one of the things I used to do as a manager is walk into a new building and go to the top floor, look at every single space within the entire building and find out where it is. Where's the space? Where's the empty space? So I hate to tell you this and admit it to all of you, but at Home Forward, I did have one person who I put her in the bathroom. And I just had the maintenance folks put a box around the toilet. Later, they capped the toilet, but it was an extra bathroom and it was large, and it worked quite well for that type of meeting, as long as the resident services person is safe, right? Because too tight is not safe. Right now, one of the things that is wonderful is that people can access telehealth. You can get counseling and services in the privacy of your own home, so that you don't have to think about space in the same way you used to think about it. I'd say, sadly, 80% of the people that I serve, that I see as a therapist, are telehealth. But that means that I can see anybody in Oregon, anywhere in Oregon. Your residents have that access. If they have an Oregon Health Plan, they can get counseling in their home, telehealth, okay?
Thank you. We have one more share over here. Oh, we got a new speaker. All right. You're being pointed at. How do you feel about it?
Volunteering.
Oh, no.
I quite forgot what we talked about. Ethics and boundaries. I work for PCC. I'm a benefit navigator for Portland Community College, and I serve students across the state. Basically, as long as they have an active G number, they can come to me for services. The reason I'm taking this class here with you is because a lot of my students are in need of other services, and you guys are a wealth of knowledge and resources and information that I need to do my work. Boundaries at my work means not sharing the intimate and very detailed information that students bring to me, even as a way of venting out to others, because it can be very, very heavy on my heart and on my mind at times. Times are hard, where post-pandemic, a lot of students come with like super, just like excruciatingly hard situations, to my office and through the appointments. To hear that and keep on having to say no, because majority of the need is housing, and that's not, available for me to offer to my students. It can be very challenging in times that, there are days that I just don't know, what am I doing? Is there really anything that I actually am doing for my students? It's so important to stay, aware of where I am and my work, and not share that information in a way of venting out to others. In terms of PCC as an organization, ethic and boundaries definitely speaks to the confidentiality of information that we deal with. I have access to a lot of information from students. This can, we're talking about all the aspects of their life. When I use that G number to log into Banner, then I can see everything. This not only can result into, I don't know, like identity theft. They can access to all of that information super easy these days. But also, as I was sharing with my folks here, it can change the perspective of professionals, even in regards with that specific student that I'm working with. So it's really important for me to stay vigilant and aware, and follow the policy in that regards of just doing what I'm supposed to be doing with that information, have it away from access otherwise and by all the other people, and not just keep on referring back to the policy, because once you review this very important document, for the most part, you have it in your mind, but review it with myself and practice it in everyday work.
Thank you so much for the share. It's a great segue to talking a little bit more. Oh, we got one more. Oh, wonderful.
I'll be brief. When I started working at and hey Theo, it's my colleague there. When I started working at the company I'm at, PCRI, is Portland Community Reinvestment Initiative. I started as a resident service coordinator, and I always tell everybody I was in the Marines before, so I know how to shut down things. But I think as a resident service coordinator, when I took on that billet, it's something that you have to know that that's something you are able to do. And what you do is you're dealing with, those of you that may not know, you're dealing with individuals on a regular basis, all types of individuals. So an experience I just had, and it was a blessing to me. I met a gentleman, he's passed since then. And when I first got there, some of the managers had told me that we have to have I can't remember verbatim the name of someone like a translator to speak with this individual. He was a musician and he was rather animated. Anyway, one day he came into the office and I was able to speak with him, and we conversed for a while, and we began a relationship. And what happens is with our boundaries, we can keep our boundaries, not volunteer so much information up from ourselves, but listen. And I began to listen to this individual, and I listened to him, and it went a year, it's been about 2 months since he's passed. And I found out so much stuff, so many things about this guy. He played with Jimi Hendrix before Jimi Hendrix had made it. He played in the cotton clubs around Portland way back. I was born in '66. He's older than I was, but he had a book, a suitcase full of pictures and all of these different things. And no one, afterwards, he came out of his shell, and he would play his guitar down in the lobby. And he started giving guitar lessons. So I guess my point is we have to be open to listen to individuals. I would pull the door closed, and he would confide, and we would talk about different stuff. And I got to see the pictures of him way back, pictures of Jimmy. I think I probably told you, Theo. And he passed away, and his family asked me if I would come to the service and all. And later his wife passed also. But I guess we can't be robotic also. Even though we have these boundaries, we're people. If I come to her and I say, hey, my name is Lee, she says hi, and we strike up a conversation, it's no different than when we're in the building with our individuals. We just have to, I think you know what I'm saying. We are people. We're not this all day. And I'm gonna text my sister right there from here. You know what I mean? We're not that. So we have to, you see what I mean? Yeah. I hope you guys understand.
That's huge. No, it's important. We're all sharing space and getting to know really wonderful human beings. At Transitions Projects, we had a policy where we were allowed to have a personal friendship with a participant after a year after our service with them. But in our relationships, we get to know each other. And we had like the fair share policy, which is you can share a little bit about yourself. There's nothing wrong with that. We just don't want to burden people with our experiences. Just for the sake of time, I'm going to move it forward. There's a lot of information jam-packed in here. So boundaries are not only about the exchange of goods, currency, and information. They're also about how we carry a person's story. And oftentimes we're carrying that physically. I heard that from the lovely lady here that was sharing how she didn't want to tell people's stories, but you could tell it was weighing on her heart what folks had been through during the pandemic, what her students at PCC are going through. So there's definitely a need for us to regularly evaluate how we're holding those stories and how that's showing up in our body and how much of that we're taking on as a provider. And I definitely struggle with that as an empath and as a human, wanting to do more than I probably should a lot in this career. And it's definitely a bargain that we need to have with ourselves. And there's also, I benefit from therapy. And there's a lot of techniques with kind of learning to relinquish that story and pass it back to people so you're not carrying it. I felt that a lot in sex abuse cases where my body, when I'd get out of work, would just be clenched up because I was physically carrying the discomfort that the fact that these children were being exposed to such horrific things. So boundaries are also about what you're carrying, not just the story that you're telling someone else's story. All right, we're not going to dive too deep into these just for the sake of time, but we are going to, at the very end of this, do a little bit deeper of a dive. But I thought you brought up a great point. If you receive an invitation for a graduation for a resident, and this is part of that humanity piece, right? We're a human. This is a huge point in this person's life, and we've become a player, a person in their life. And it's important for us to show that we are invested in their success and their strides. And there's no boundary that says that we can't celebrate that with them. That's important. Where the line is are we going to have drinks after graduation? I liked that, friendly but not friends. Sometimes I do consider my folks friends, but I'm definitely not going to imbibe, even if I want to, because you have to kind of set the mark of professionalism and make sure there's not a space in which those boundaries would be crossed. All right.
So I think I like to think about it as role clarity. Okay, what is my role and what is your role? What is your role as maintenance? What is your role as property management? What is your role as resident? And what is my role as resident services coordinator? Does that make sense? When we're clear about our roles, boundaries are easy. So as a therapist, I go to people's major things. A wedding, we worked years to get that person ready to be in a relationship. They find somebody, we connect around that. I help them let themselves fall in love. They ask me to come to their wedding. I will go. I will not party with them. I won't go to the reception part, right? But I'll go to the ceremony. It's important to them. I want to say you talked about culture, and in other cultures, it's about giving. That's in our culture too. We are givers. We are human beings who like to give. We're not takers. Your residents are not takers. So exchange information, let them teach you, let them help you, let them give you ideas, let them tell you about the last resource they used. Let them give you a small gift. It's okay. It's within their means. That would be a way to think about it. Is it in their means, or is it outside their means? Because if it's outside their means, even if you share it with your staff, you shouldn't have taken it. And you can say that. You can say, listen, you spent too much, right? It's not fair. That's what I do. This is my job. It's okay. Offer, okay? We want you to offer so that they can offer. Okay, oh, it's me. No, oh, how convenient. Okay, so what I want to talk about first is what is confidentiality and what isn't it? This is the most confusing thing for people. So confidentiality is that you do not discuss identifying information about the people you work for. That's what confidentiality really is. So you do not discuss identifying information. So I get to go home and tell my wife that I had a bad day. I get to tell her without offering her vicarious trauma, right? So being kind to her. But I get to say to you, this is what happened to me, because you already have been through trauma, so might as well share, right? And I get to tell you what happened. And as long as I don't tell you the apartment or the person's name or what their job is, right? They can't be found, then it's okay. And the most important part is it's a small state. You all are in small communities. And that's actually why I picked my wife, because I know who she knows, right? Because if I start talking about somebody, there's a chance somebody else might know that person. And so you have to be super, super careful about that. A way to think about what it is respect. So do you respect their story, or what Zahra was talking about earlier, and a term that I just learned from her, which is ethical storytelling, which I think is an important piece, right? So confidentiality is done or communicated in confidence. It's entrusted with the confidence of another person. So somebody tells you something because they trust you. And it's very similar to what you were talking earlier. It's this long relationship that you build so that trust can happen, okay? You want to think about that when somebody's talking to you like this, it's intimate. It is a time maybe they've never told their story. When we were opening the Bud Clark Commons, I asked people at one of our properties to volunteer, they lived there, and pretend they were homeless, and let other people survey them for an assessment to see where they might fit, what building they might, whether they qualify or they don't qualify. But it was a way to teach service providers how to do the assessment. The most important part of that was letting people tell their stories, and what we learned from that training was that some of those folks had never told their story before. So can you imagine being 60 or 50 or 20 and you've never shared? Okay, so the idea is to leave space enough and non-judgment enough to allow people to tell their story, okay? So what confidentiality is not, and this is really important. First of all, if it happens in public, it's public. Okay? That's the most important thing, and it's very confusing for resident services. If it happens in the community room, or it happens in the lobby or the hallway, it's not confidential, public. Okay? That may mean something, may not. But it does mean that it gives you access to talking about it in a really different way, reporting about it, communicating with property management. It's just easier. Okay? Public and private. So directly observed behavior, you see it happen. It's public, like I said, it's a statement or an action. It's observed in public. So I also want to say in the street corner, right? Anything outside the building. It is a threat to another or to self. Okay, so they might hurt themselves or they might hurt someone else. They may tell you that they know of somebody who is going to be hurt. Okay, so I was going to my property one time and this man comes out of his unit and he says to me, "I'm gonna go kill the mayor." And I'm walking to go kill her. And he starts walking towards downtown Portland, and I think to myself, I got a call. So he was very angry and he was super clear. Okay, so that would be a time when there's no thinking about it. You just, at that time, I literally had to go find a payphone. But that said, it was, you have to call and make sure that the mayor, they know. Okay. Child or elder abuse. And this includes suspected abuse. Okay. Lease violations that can harm the community. So fire would be the simplest one to think about. Information that a resident asked to keep confidential, but keeping it confidential violates the policy. So when I'm working with somebody and I've already given them the spiel about confidentiality, and you should have it on in your office, a little sign that says what you have to report and what you don't. But I tell people, and then if they're about to tell me something where I think I might have to report, I stop them and I tell them that that's about to happen. Then we report together. I ask for them to do the report with me. If they won't do it, I'm going to do it after they leave, so it's up to them. And that's pretty much how I present it to them. Okay? Does anybody have any questions about what it is and what it isn't? Okay. When you're thinking about why to hold confidentiality, why it's important, again, we talked about respect. That's kind of the best one to think about. But your mission and liability are the other two. Okay? Realize what you're here for. Why are you helping them? And if it is real help, these are the reasons when you think about what you should do or not do. And I will tell you, in terms of ethics, when I think to myself, should I probably shouldn't. Go drinking with a resident? Nah. Go to that party? Nah. Okay? So in terms of the ethics and those types of things, when you're sitting there like, oh, I really should go. What should I do? Should I blah, blah, blah? Probably you shouldn't, or you should report. That's the other thing. And you don't want to. So get your boss or a colleague to help you, to tease it out. We don't do ethics by ourselves. We do them in concert with other people. Okay? When we talk about exceptions to confidentiality, and actually, Zahra is going to talk a lot about ethical storytelling at the end of the day. The grassroots community advertising. So I want to remind you, we're not going to talk too much about that today in this workshop because there's a whole thing about it at the end of today. So exceptions. So exceptions to confidentiality, safety issues, potential danger to self or others. There's a court order. There's suspected child or elder abuse, someone's housing is in jeopardy, or there's some emergency around medical or mental health, okay? So I like to think about it as need to know. What does somebody need to know in order to do their job safely? So if you have a resident who is having a hard time, they're really not doing well, but they're safe, nobody needs to know. But if you have a resident who is angry and threatening, and you have a maintenance person who's going to go in there and fix that sink, you got to let them know. They're your team. You work together. So don't hesitate to make sure that your colleagues are safe and that you're safe. And it's an important piece to think about, especially with maintenance. I want to hit this hard. Maintenance is the most dangerous job in your organization. So who has a partner thing? You have a partner thing, no one person goes in a unit. Is that true for maintenance? You know, I'm curious.
I'm stuck. I would have gotten up. We do have exceptions. We do have people that are on like a mandatory 2-person entry, and that might be if they are a survivor of trauma, especially since the majority of our maintenance staff are male. And it might be a situation where, as a resident services coordinator, I might want eyes on that particular living situation. If there have been a lot of reports, I might just ask if I can go along. Mainly it is centered around trauma though, so.
Oh, great. Okay. Third party. Yep. Yep. So I do think it's interesting that what you were saying is for the resident. Trauma informed for the resident. You are a worker of a nonprofit organization, and you probably have been through some sort of trauma. Well, we all have. We had COVID. Now it's the great equalizer. So maintenance people who work in that profession have been through trauma. So I want to really put that out there, that we take care of ourselves, we take care of each other, okay? And I love this graphic. We're talking about resident services today, which is why this is so big. But if we were talking about any of these other disciplines, those would be the big ones, right? We just want to have you focus on the resident services component of this. But we can't do our jobs without our team, our multidisciplinary team. Okay? So how do we share information? An ROI is a release of information, and you can have lots of different kinds of them. You can have one where you share only with medical. You can have one where you only share with family. You can have one where you only share notes. You can have one where you only share payment, as an example, if somebody has a payee. So you can make as many different kinds of releases of information as you need and have a lawyer or your legal department look at them. They're good for 1 year. Okay, they're not good past 1 year. It's kind of an important piece. So at Recert is a good time to redo releases of information. Did you have something to add? Okay. So, and it's 11.
We've got 30 minutes.
Great. So I want to talk a little bit about the relationship between property management, maintenance, and resident services. Before we do that, you can pass them out. But so when you are thinking about how to share information, we talked again about need to know. So that stands always. Even when you get a release of information, you're trying to decide which ROI you're using so that you line up what it is you're asking or telling people based on what they need to know, whether it's a case manager, a property manager, a family member, etc. when you think that, like, an example is that resident services is working with a site manager on a lease enforcement issue concerning an extra person in the apartment. They share this information about that, but does that, but does not also share about the resident's abuse history, psychiatric symptoms, debt problems, unless that's pertinent to the lease issue. Does that make sense? So when a person is talking to you about having a guest, unauthorized guest, the issue is about the guest, not all the other things surrounding that person, unless somebody might be in danger when they go talk to that person. Or maybe that person is their caregiver or health provider. So thinking about how you're going to communicate those pieces of information to the other people on your team. Does anybody have any questions about that? Comments or statements? Okay. Oh, I'm sorry. Great. Wonderful.
Our ROI includes the hospital, police department, managers, partners, everything that we can think of, and it gets updated annually. So that way, if there's a conversation about extra guests in their apartment, well, that's a housing or a lease agreement situation. So it gives us the authority, and then they list all who's ever in the home, that if it's about anybody in the home, or if they want to selectively leave somebody out, we can talk to housing about whatever the situation is, as long as it's in that category that's in that ROI. So it's pretty lengthy, but it's one document, you're good to go, and as long as it pertains to that.
No, the confidentiality policy, before we move on to this. Oh, you didn't? Okay, that's fine. Did you want to speak?
I just wanted to ask, do you have in the peer group any resources that show samples of ROIs? Because I noticed that the place where I'm at, we had a change of property management, and the previous property management took everything with them, and we have to start over with the new one, creating everything from scratch.
That's good. I don't know if in the drive or any of the ROIs, but we can make sure to put them in there. I'll make a note to myself to do that. And we can go, obviously, have more deep conversation, because one of the things we're not talking about is third-party property management versus they're inside your organization. That said, because there's a contract, you're allowed to talk to each other. The contract is actually your cone of silence that says you're allowed to communicate with one another. Yes. We will put the confidentiality policy for Home Forward and a couple of other ones in the Google Drive so that you have that as well, just so you know. Okay, so this is you have a handout on your tables of scenarios. Those are listed, let's see, 1, 2, 3, 4, there's 5 of them. You want to put them in groups? Corner, right? No, at tables. Yeah, let's just keep you at tables. So the top one, scenario 1, a residence adult child calls. That's this table is going to work on that, and this table. Okay? Property management wants you to tell them this table right here. A maintenance person comes in to tell you that he saw someone was living without a bed, this table. A Somali male resident comes in, this table. You have a great partnership with Not Human Solutions, Our Just Futures. At this table, this is why when you're old and dated, this is what happens. For those of you in the back, if you want to come join a table, that would be helpful so you can participate. And for those on Zoom, you have a great partnership with case managers, and one of them calls. That's going to be your prompt. Did you not get it? You're going to do a maintenance person comes in to tell you, okay? All right, I'm going to give you 6 minutes. I want you to think about boundaries, ethics, and confidentiality, okay?
Hi, this is Shauna again. It sounds like, so I heard our prompt is we have a partnership, a strong partnership with a case manager that calls one of us. There wasn't more information. They gathered more details with that.
That's all I heard.
Okay. So it's kind of open, I think, for us to talk about. I think for me, you know, if a case manager called, there's so many variables in that. You know, what's the issue? What are they calling about? Who's the client? That kind of thing. So I feel like there's many things to consider, but I think it does go back to that. I love the what do they need to know? Just like having that always in the back of your mind. And to me, it would be very specific to the situation, but I would make sure there's an ROI involved. Bridge Meadows works closely with Oregon Department of Human Services for family referrals, and we need an ROI in place right away when we start those conversations. That's typically the first thing that is given to us from ODHS to start those conversations and connect with the caseworker. So I'll start it there and just put out the question, what do others have in place, and what would folks do with the case manager situation?
Okay, this is Amal with Our Just Future. So for us, it depends. Like sometimes, either whether it's a caseworker or a family member, I always stop them once they identify themselves as the resident, because the ROI I have on file is me to communicate with maintenance and management, so not with anybody else. I make sure that unless the tenant is with them, then we can talk, you know. But if the tenant is not present, then I request an ROI. They can snap a picture of it and send it to my phone. It's a mobile phone. And we go from there. If a caseworker calls, I just make sure that we have an ROI on file.
How about anyone else? Are there other examples out there related to boundaries and ethics and with caseworkers? And I guess we could open it up to anything else that we want to talk about or connect on.
I want to throw it out there that sometimes, even though I request the ROI, they continue to let me know what they were calling for without me saying anything or adding anything to it. And I take that information as a good to know kind of information.
Oh yeah, thanks Amal. That's really great too, is sort of taking that role of active listening, taking down information versus sharing, right? Grace, you and I work together. Do you have any thoughts on caseworkers calling or any experiences that you've had with Bridge Meadows?
Yeah, I liked what you shared also, Amal, where, I've had caseworkers and other folks connected to our residents who have contacted me around maybe different concerns or, with
You
their
have
relationship.
2 minutes left.
With their relationship with the resident, they might see something, and it can be really helpful just to take that information as like, okay, let me take note of that, and then at some point later I can maybe follow up with the person or check in on the concern without actually sharing that information. And then I've had times where I've had like medical staff want to connect. And if I've had them reach out to me a couple different times, always looping in, our community members for that ROI, if it's going to be a collaboration of any sort. But like Amal was sharing, sometimes it's really helpful just to hear what insight they might have without needing to share anything myself. Yeah.
Yeah, like one reason that I had was a caretaker called me because my tenant was, in a care facility. So they were like, "Well, I'm sorry, I don't have an ROI and I can't get it to you, but just want to let you know that your tenant is being hospitalized." So I was like, "Oh, thank you for letting me know. I am gonna inform management." And she was, letting me know that the tenant requested that we don't put notices on her door while she was away, and which was really good
All right,
news,
I want to
like
bring you back into the room. So wrap
okay.
up your
We got cut off again.
conversation and come
Yeah,
to the
but
center.
it was
Thank you,
something
Amal and Grace.
helpful
Yeah.
anyways. Yeah, it was very helpful.
Yes.
Wonderful. If you can hear me, face this way. Thank you so much. These scenarios come from your organizations, obviously. They're not ones I made up all by myself. I've had them around for a long time when I've done this course before. So tell me, just raise your hand, call out, not at tables. What'd you find? What'd you learn? What'd you talk about? Yeah.
Ours was number 3, a maintenance person comes to tell about someone living without certain resources. And we just talked about sometimes it could be a cultural thing. Maybe their culture doesn't use or employ the same furniture types that other cultures do. Some cultures, it's common to have a bedroll or something that they put away during certain times of the day. So, but anyways, we talked about how the maintenance person is, member of our team, they're extra eyes and ears. And again, if that role is for the sake of, or them telling is for the sake of helping the person, it may be an indicator that maybe an older resident or someone with impairment is needing next level of care. Maybe they're not able to do for themselves anymore. So it's a great temperature gauge, like it's getting heated over here, or we need some supports over that way. So it's a blessing to have maintenance that are open eyes and open ears in a non-judging fashion to support the wellness of all residents.
Thank you for that. I will say that there was a person a long time ago who did not have a bed, and maintenance saw that when they went to do a repair, and we were able to just flood whatever services. It took 3 years, but over time, getting her the services that she needed because she was so afraid and not wanting to connect with anyone. So because of him, we were able to just bridge this big gap by offering a bed, right?
So unfortunately, after COVID, we found quite a few residents, mostly seniors, hoarding because of past trauma. They could have grown up in the Depression. And so they were hoarding again. So we had a lot of that. So fortunately for our county, we have a hoarding team because we got trained that you just can't start removing stuff without creating more trauma. So that we, by the maintenance coming in and just checking on the heaters after COVID, that's where he identified those folks to get extra services.
Thank you very much. Anyone else from your conversation, something you want to share with the group? What came up? Yes. I'm going to have her and then you.
We did talk about how our different roles in our organizations kind of shaped our viewpoint of these ethical considerations, and so, and especially like a third-party property management brings in some other issues, of course. But yeah, that was an observation we made.
Anyone else? Oh, thank you.
I just want to express my frustration right now because I don't know if this is unique to our organization or not, but our maintenance team is actually not part of our team. Because we're St. Vincent de Paul, and so they do the stores, they do the vehicles, they do a lot of other things. So they are not part of our team in property management. And so that's very frustrating to hear the wonderful things that maintenance can be doing. And I love our maintenance team, don't get me wrong, but they're not trauma informed. They don't know how to recognize and report child abuse. And you know, we have been kind of trying to get those balls rolling, but I just wanted to speak my frustration on that. Maybe you can advocate for us.
I'd be more than happy to. I'm going to tell you how I fell in love with maintenance. So at Reach, we had to do job shadowing. And every all staff meeting, there'd be a big poster up with Post-its, and you had to take somebody's name and promise you were going to job shadow within that quarter that person. And it could not be somebody in your discipline. It had to be a different maintenance. It could be maintenance, property management, asset management, development. That's how I learned all this stuff. It's actually how I learned all this stuff. And so I dressed up as John, the maintenance guy. I put on coveralls and I got myself a painted Reach shirt and I got myself some big boots. And I went out there, I was 25, and I was like, I'm ready. And he taught me something I didn't expect, which was not how to fix a sink. And that's how I learned about maintenance, that their heart is quite big. Their hearts are big. And in terms of trauma informed, at Home Forward, we had a domestic violence advocacy relationship with two folks through YWCA. And one of the things we did with that relationship is we designed a training on domestic violence that we did at every site team. So we did it, there were about 300 staff people. We did it 15 times. We just did it with all the teams in small groups of 7 or 10. And one of the things that came out of that is maintenance saying, you mean we're not allowed to kick their asses? And then we talked about what trauma informed is. So I do think that what they want to do is help and support and be there. And we get to think about how we use them and how we help them, because we have a skill they don't have and they have a skill we don't have. Okay?
We got 5 left for Q&A. Let's do an ask an expert. I mean, you're the expert, by the way. So does anyone have anything that feels ambiguous or that you're not quite sure on as far as ethics go? No judgment. Does anyone have any ethics topics that folks have debated at your agency? Wonderful.
We were doing the one with the resident, with the adult child, and it's kind of hard to answer that question because there's 2 scenarios. You know, what if there's something really wrong with the people? You have to go get a a wellness check and post something on their door and then go back 24 hours later at the place where I work. But if the adult child, if we were to find something that was not good, I would say, how would we go about not knowing if that person was the child and reporting that we found something bad? Do you get what I'm saying?
Yeah.
Okay.
So you're gonna pull a file and figure out who the emergency contact is for that household. So that's who they've already designated as their person. And my hope would be that they would contact the adult child. Let's read the question out really quick. Can you point at it for me?
The first one.
A resident's adult child calls and asks if you have seen their parent. They are worried that they haven't called and want to know if they're around. You've never met this person calling and you know that the resident has a child. What do you do? So we can't ever confirm or deny whether someone lives at the property. We don't get to share anything of that nature. If you're feeling that, genuine concern from this person, you can say, I cannot share whether that person lives here or not, but I can tell you that hypothetically, if I was concerned about a resident, I would be checking in on them. So you're not confirming or denying whether someone lives there, but you're showing that you genuinely care about the people that you're serving.
And I'm going to add to that what you can do is a welfare check yourself. So my favorite tool, and this isn't true for every property, but if you have a fob system, you can go to property management and ask if the resident has gone in or out in the last couple of days. If you know whether they've gone in or out in the last couple of days, you know you did your job. You still can't go tell that person, but when you see the person in the hall, you can be like, your daughter called and she's looking for you, because you do not have confidentiality with that person. Only your residents, okay?
A really big thing that I just came to the property where I'm at right now, and the biggest thing people keep saying, residents keep saying, is, can't you check the surveillance cameras? Why don't you go check the surveillance camera and tell me if they touched my car? Tell me if they did this or that. Oh my gosh.
I really want to remind you about role clarity. That what you're saying is, I am not security, I am a service provider. I provide services. So I realize you're scared, and let's talk about you're scared, or you're worried, or you're angry, but I don't do that. And the nice part about that is you can say to them, I'm never going to be watching you like that. I don't do that. Okay?
So just a side note, although we'll share with law enforcement if there's an emergency in our building, you always run it by, if someone's coming by more casually, even if they show you credentials, always run it by someone above you. And you don't have to share anything with immigration services or with an ICE agent. Ever.
So we have 1 minute. We can do one more question, and I recognize that you've been sitting a while. If you need to leave, that's okay.
I just want to say, if you are in resident services, you use the tools that you have. If you do have access to a fob, many of you may know that you can see the time that the fob was used and get to know your residents. If you're in a community, I feel like I'm in here, I'm going, man, our company got it going on. That's the way I'm feeling, because we have a community at Kings Plus Park, Beatrice Memorial, and everyone knows everyone. They come through the office, they go and get drinks or whatever out of there, but get to know everyone. And that at that time, you'll know what's going on. It won't be a problem if Mrs. Jones has gone to chemo and you haven't seen her and you go and tap on her door. Hey, you in there? Yeah, I'm in. You see what I mean?
I think that's true unless you have 400 units. Okay, so there's one building that has 285 units that I used to serve, and sometimes you just can't know. And some people isolate. So I do want to put that out there. I'm going to save your question. We're gonna have lunch. There's a speaker. There's a lot more workshops coming this afternoon. I'm around if you have questions. I'll put up later my email because I told Zahra not to do it and I was wrong. So I will see you all in about an hour and a half.